Hello everyone, I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty. Now we will be studying about the oral candidiasis. From oral candidiasis, you can either get a 2-mark question or a 5-mark question, not more than that. It is a topic from which you will be getting only short notes. So prepare this topic from that perspective only. Let's study. So definition, oral candidiasis is a fungal infection that is occurring in your oral mucosa. See, the tongue. Okay, that is a tongue which is covered with white thing, that is your oral thirst. They are affected by the Candida species, most commonly the Candida albicans. It is an opportunistic infection occurring when the host immunity or the local environment is altered. So see, if the person is having any sort of immunological disorders, or if the person is having viral fever, due to which the immune system of the person is getting altered, there are higher chances that the person will develop this kind of disease. Okay, so you need to keep in mind. Okay, if I talk about the etiology and the predisposing factors, so you have the local factors like the poor hygiene. If the person is not cleaning his tongue properly, there are chances that the person can develop this. Then due to xerostomia and smoking. What are the systemic factors? In systemic, you have the diabetes mellitus. Now guys, whenever we are talking about diabetes mellitus, it's your responsibility to revise the criteria of the diabetes. Then if the person is having immunosuppressions and due to broad spectrum antibiotic use. Coming to the pathogenesis. So in the pathogenesis, let me just draw it for you. This is your tongue. First thing what happens is there is colonization. There is colonization of oral mucosa. Colonization of oral mucosa. After that, what happens is there is overgrowth. After that, what happens is there is overgrowth. After the overgrowth, there is adhesion to epithelial cells, and after the adhesion, there is invasion. After the invasion, there is inflammation. You need to keep this in mind. Okay. So what are the types you have? First one is Pseudomembranes Candidiasis. It is white curd-like plaque which can be wiped off. See this first image you are able to see. So this kind of things that can be wiped off is your Pseudomembranes Candidiasis. Next you have erythematous. Erythematous, name is only suggesting you. Erythema means red. Then you have the hyperplastic one, in which the white plaque cannot be wiped off. That is also called as your leukoplakia. Angular chelatosis, that is around the this figure E, that is around the corners of your mouth. Then you have the denture one, that is inflammation is under the denture. What are the clinical features? There will be burning sensation in the mouth. There will be curd-like plaque, red or inflamed mucosa, and dysphagia can be there, and cracking at the corners of the mouth. What are the investigations I will order? I will order the KOH mount, in which I am able to see the budding yeast, then the pseudo-hyphase also. In the culture, I will order the sabots or dextrose agar media. So, SAB is a fun guy. You can remember it with a mnemonic of that there is a person by the name of Sab and he is a fun-loving guy. So Sab is a fun guy. So Sab is for your fun guy. Then you have is the HIV testing in immunosuppression patients. What is the treatment for local therapy? I will give the patient some gels and suspensions. For the systemic one, I will give the fluconazole and other. Then you need to address the underlying causes like control the diabetes, stop antibiotics and steroids, maintain oral hygiene. See, maintaining oral hygiene is very, very important. You have to counsel the patient for this. Then you have to clean the dentures. What is the prevention? For the prevention is easy. Maintain the good oral hygiene. Clean your dentures regularly. Avoid unnecessary antibiotics. Control your systemic disease and use antiseptic mouthwash. See guys, these topics are for your short notes only. So study these topics from a perspective of your short note only, not more than that. Okay. So I hope and I believe I made this topic very, very clear for you. If you have any sort of doubt, please feel free to ask me. Please feel free to DM me. Thank you so much.